Uh, Thank you, Chairman Watson Coleman. I appreciate this hearing and the testimony of our witnesses. And Dr. Kelly, I'm also a physician. I'm a former director of public health. And I'm going to start this by saying that I'm fully vaccinated. And in the 24 counties in my current district in Iowa, I had held vaccine clinics in all 24 of my counties. I've encouraged people to be vaccinated. I've helped assist them. I've answered questions. And one of the things that I have found very disturbing, over the course, and especially when President Biden said he would institute a vaccine mandate, has been this division and pitting of vaccinated people against unvaccinated people. And even recently, the CDC said that they have no data or information on people having had infection-acquired immunity or natural immunity, having been hospitalized for COVID-19, or they have record of those deaths. So you had recently asked the White House to delay the executive order deadline until January 18th for all federal employees to be vaccinated. So the deadline would be consistent with the mandate for federal contractors. Mr. Cassaretti has expressed the same position for the Air Marshal Association. So Dr. Kelly, can you explain why AFGE is concerned about the November 22nd deadline for federal employee vaccine mandate, or is it just consistency?
Well, it's a number of things. First of all, this double standard has caused a lot of confusion, right? Because, the federal employee is asking me the question, why do I have to work right beside a federal contractor that don't have to be vaccinated, and it can come to work and work beside me and, possibly expose me. It's inexcusable that, the contractors are being given the entire holiday season to meet the mandate while federal employees continue to be subject to the November 22nd deadline. But we think that if there was some parity here, it would at least give the federal employee an opportunity during the holiday, to talk with their families, and be able to rationalize, can I really go and do this, and get back to where I need to be as a good federal employee? That's the idea here. It's a sense of fairness. It eliminates confusion, and those types of things is why we have asked the White House to make sure that we have the same deadlines.
Yeah, and I would agree with you. I think I've been, as I said, I think shaming, blaming, ridiculing people, whether it's on social media or in person, is not the way to get people to be vaccinated. And I also think that there is, this lack of recognition of infection-acquired immunity, which with the Israeli study has actually demonstrated that it is as equivalent or even better. So there should be a recognition for those people who have had COVID-19 and recovered that they have immunity. So we should be talking about immunity and not just vaccination. And to that point, I have a bill that would mandate coverage, insurance coverage, regardless of the type of insurance, for serology testing, which would be humoral antibodies, but also T-cell antibody testing, which is the longer term immunity for viruses, both of which have been long lasting, less so the humoral. So it's one of these ways to prove that there is immunity from COVID-19, because we know even if you're vaccinated, you can transmit the virus. So it does seem to be a double standard. I would agree with you on that. And we'll keep continuing to push those issues. And I would say delaying the mandate to have the same date as January 18th would be a sensible policy. And it also would help you in your desire for parity among those that are federal contractors. Can you also explain how this requirement is going to impact the TSA? And let me just say that the TSA, like healthcare providers, like essential workers, throughout the pandemic with no vaccine for 15 months, worked, kept people safe, kept their coworkers safe, and kept each other safe with personal protective equipment, distancing, protective barriers. And so they were able to keep people safe, even though they were at risk themselves and risk their family members when they went home throughout the pandemic without a vaccine, which is another, a source of hypocrisy to me in the mandate. But how these requirements impact the TSA and its ability to be fully staffed at airports and surface transportation sites during the upcoming holiday season, as you mentioned.
Well, again, it's certainly my belief that, the lack of staffing, is not really related to the mandate. You know, I strongly believe that. I strongly believe that the lack of staffing and the issues that we may face, you know, come this holiday season, you know, with a staffing shortage, if you call it that, will be because of the fact that we just did not replenish the workforce, you know, and because of the fact that we not did all the hiring that we said we was going to do. Because you still got people that we've hired still in training, not even on the floor yet. So, in my opinion, that's where the problem is going to be. But the workforce has been very patriotic.
Thank you very much, Dr. Kelly. The gentlelady's time has expired. I'm sorry. Thank you for
Thank you.
your
I'm sorry, I
information.
didn't see
We
the clock.
appreciate it.
I yield back my time.
Thank you to the gentlelady.
Okay.
So I want to thank